What does healed TB look like on a chest X-ray? Imagine looking at a chest X-ray and trying to understand what signs show that tuberculosis has healed. When TB is no longer active, the X-ray reveals specific features that tell a story of past infection. These features include fibrotic scars, calcifications, and changes in lung structure, mostly seen in the upper parts of the lungs. These changes happen as the lung tissue heals and the infection becomes inactive. One common sign is the presence of fibrotic scars or linear opacities. These are dense, well-defined lines or net-like areas of scar tissue within the lung. They often cause the affected lung segments to shrink or pull back, leading to volume loss. This shrinkage can cause the lung tissue to appear retracted, especially in the upper lobes. Sometimes, the lung structures like fissures, the hilum, or even the trachea may shift slightly toward the scarred side due to this volume loss. Another hallmark of healed TB is calcified granulomas, also called gonfocus. These are small, round, dense spots that appear on the X-ray. They are usually found near the lung's outer edges or near the hilum. The calcification indicates that the immune system has contained the infection, and the granuloma has become inactive over time. These calcified spots are a sign of old, healed lesions. Architectural distortion is also common in healed TB. This means the normal lung structure appears irregular or misshapen. You might see thickened areas of the lining of the lung called pleura, or signs of lung tissue scarring that cause the lung to look uneven. Sometimes, healed TB leaves behind air-filled spaces called bullae or widened airways known as bronchiectasis, which are signs of previous damage. Importantly, in healed TB, there are no signs of active infection. This means no areas of dense lung tissue called consolidation, which indicate ongoing inflammation. There are no thick-walled cavities or surrounding haziness that suggest the disease is still active. Instead, the X-ray shows stable, calcified, or scarred areas that have stopped progressing. Small nodules or fibrotic spots may still be visible, often in the upper lung zones, but these do not show signs of worsening or inflammation. These features confirm that the TB infection has entered a healing or inactive phase. Overall, healed TB on a chest X-ray appears as a combination of scars, calcifications, and structural changes mainly in the upper lungs. These signs reflected the body's healing process after TB infection and help doctors distinguish between inactive, healed disease and ongoing active TB. Remember, while these X-ray features are helpful clinical assessment, and sometimes additional tests are necessary to confirm the status of the disease. Always consult a healthcare professional for personalized diagnosis and advice.